Hey Facebook, just wanted to check in with you guys, let you know what's going on with Lab Weekend. Yesterday was Friday, so we had immersion day. A couple PTs came in and hung out with me for the day, just watching what goes on and how things work with the system. So got a really good example of why we do what we do and go through the steps of what we do with an eval yesterday who was referred for low back pain. As we're going through the screen, find out she's got a history of neck and shoulder issues stemming from a car accident in 2002, re-aggravated those injuries about 2 years ago in an ATV accident, and figured out that the low back situation was also tied to the neck and shoulder issues. So that was a really good demonstration of why we do the things that we do and why we go through the steps that we go through. So they got to see that. Also got to see regular patients going from screen to treatment to patient education to exercise. So another good thing that they got to see is how efficient it is when you have a systematic thought process that you're following all the way through. So most of the visits that we had yesterday, I would just look at my watch when we got done, and we're about 20 to 25 minutes into it, and we're wrapping visits up. So we're not taking an hour. If you're doing cash pay and you think you need to take an hour with people, no, you don't. And you think people want to be with you for an hour, no, they don't. They want to get in, they want to get better, and they want to go home, or they want to go back to work. So stop wasting people's time thinking that they want to spend an hour at physical therapy. Shrink the treatment time, which is going to increase your income per visit per hour, and get them results, and they'll keep coming back and they'll keep referring to you. So after we got through immersion day, then we went into a quick review of what the students have been working on in their modules in the shift. So we went through and reviewed neuromuscular physiology, did a really quick review of a little bit of critical thinking skills, and then got into screening, running through every student running through the screen with each other and seeing what they could figure out by doing the screen, and me running through and talking through why we do and what we're doing when we're looking at those screens and what we're actually looking at and how that's going to work into what we're going to do today, which today we're going to get into neuromuscular facilitation tests and palpations. Before lunch is over, or before we get to lunch today, we will get through all 5 quads. Yes, there are 5 quads, not 4. All the hamstrings, all the glutes, glute med, anterior, middle, posterior heads, glute min, anterior and posterior head, glute max, 2 tests there. We'll get into piriformis, deep hip internal external rotator, so quad fem, gemellus, all those guys we'll get through before lunch. So if you're wondering why you need to do the shift, Lab Weekend is a huge reason why. So 2.5 days in here, all of these students working with each other, working with me. I'm actually pulling in one of my staff PTs to help us get through so they actually understand the difference between neuromuscular facilitation tests and manual muscle tests and how to palpate correctly to get normal facilitation to return. So if you're on the fence about why you need to do the shift, Lab Weekend is a huge component of what we're doing. So you can take CEU courses till you're blue in the face, and if they are by body part, so if you're taking a knee course or you're taking a shoulder course or you're taking a foot course, you are wasting your time because all of those things work together. If you don't know how to put that together and make them work together and assess everything in one simple process, you're wasting your time. If you're taking a course that's specific for athletes or specific for Medicare patients or some kind of condition, tendonitis, whatever, you are wasting your time. Every single patient that comes to see you is a human. Their physiology is the same. If you don't know how to treat physiology, you don't know how to treat patients. So if you're wondering why we do what we do, you need to get in the shift. You need to watch 4 to 5 months of modules at your own pace, and then get into Lab Weekend where we put everything together. And when we get done on Sunday, these students are going to return to the clinic and do things completely differently than they've ever done before. They're gonna say, wow, this is a lot more effective. This makes more sense. This is easier. And now those students that wanna go off on their own, which is the majority of the people that are here this weekend, are going to be able to say, now I have something that I can use to not only get my patients better, but differentiate what I do versus what every other cash pay PT does, every insurance-based PT does. It doesn't matter what they do because I'm not going to do that, and I'm going to get results that they don't get. I'm going to educate my patients the way that they can't, and that's what's going to make them successful moving on. So don't waste your time taking CEU courses. For sure, don't waste your time going to a residency because you're going to take a pay cut to work for somebody else and get out and have no different skills than you had going into it. If you really want to launch your career as a new student or reinvent your career as somebody who's been in the clinic, we have 2 students here this weekend that have been PTs for more than 20 years. We have 1 student that's still in PT school. So from PT school to 20 years of experience, that's the people that we work with. And if that's you, then you need to get here so you can get your career where you want it to go.